All right, I want to give you a tour of the operating room. Come on in. Okay. So first of all, pásate para acá. We're going to don our gloves. I'm wearing protective clothing that not only is sterile, but also protects me from the liquids and biohazard material that we are exposed to during the surgical procedure. So in our operating room, we have obviously our surgeons, our anesthesiologist up there, and our patient who's positioned in a certain incline, so all the abdominal content can fall towards us. And we've placed some trocars or some access points, where we can access the abdominal cavity. Now, this abdominal wall has been inflated with gas, and my partner here, Dr. Martinez, is my surgical partner, is using a telescope that has a camera bonded to it and a light source, which illuminates the abdominal cavity. So now what we're seeing over here is, you're going to see the heart right here. See that? That's beautiful. It's even beating towards my hand right here. So these instruments, as you can see, they're really small instruments. That's around 1 centimeter, half an inch. But as we go in through the abdominal wall, we can grab a hold of this surgery. This particular surgery is a surgical revision of a previous weight loss surgery. This patient had a lot of heartburn, a lot of reflux. And instead of creating a new surgery, which is the typical response, what we did is we're just basically repairing a hernia that she developed. This part of the highest part of the stomach was creeping up into the chest, and that's why this negative pressure up there causes reflux. So what we did is we removed that hernia. We actually repositioned this back to where it's supposed to be, inside the abdomen. And now we're going to ask our anesthesiologist to pass a thin tube around the width of my thumb, and we're going to watch the monitor, okay, as it passes through. So here it goes, slowly, and here we go, here we go. Now you can see how this procedure is going to need some calibration right here. This whole area is intimately adhered to that tube that's inside the stomach now, but this area is very, very wide, which basically gives the patient a lot of ability to eat and overeat. And the idea of this patient is she wants to regain the original restriction she had. Sí le voy a poner, ¿eh? Está muy suelta. A ver, ¿ve? Okay, so now what we're going to do is we're going to suture. But anyways, that's a little bit of a tour of our surgical suite. And I will see you next time.